Hello everyone. Thank you for attending the oral cancer screening emboloscope. So whole point of today's class is just to see how to do the whole oral cancer screening, which includes extraoral and intraoral with the integration of emboloscope. We do often get to see that in private practice or even in school that we do the intraoral and enteral exam, extraoral and intraoral exam, but we often miss out the endoscope. Usually there is a training session in school, but a lot of dental hygienists don't get the opportunity to use it in real life. So my job today is to kind of go over it with you guys, the whole process, and kind of explain why it's so important. Okay, so starting from this slide here, this is just the different regions of your face. You might have seen this picture in the past. So we often to note down any areas that we see any atypical findings. We normally want to start off with which regions at special extraorally. So there's the frontal, parietal, temporal, zygomatic, auricular, occipital, orbital, infraorbital, nasal, oral, and buccal region and mental region. I would have this chart kind of out so when you are doing your extraoral exam, just to make it easy to reference. So this is a pretty good picture to have. So as we go through these slides, I'm just going to pinpoint a couple of areas that we want to have so we know the name of each thing. Some new ones is the medial canthus. That's something that we don't usually know the technical term for. So medial would be towards the midline, so that's why it's there. And then lateral canthus, which is on the side. We already know about the pupil, iris, lower eyelid, and sclera. Here are some other regions of the ear. So something called the helix and antihelix, more technical terms, the tragus, and then the lobe. So anytime you would note any atypical findings, you would kind of point out the right helix of your ear or the on the tragus region, or if someone has earrings or piercings, you would say the lobe or the helix. So I think something new that we don't know a lot of the times is the ala nasi. So I find that we tend to not know what the technical term for nostrils are. So ala, which is pretty common to find usually some pustules or papules in these areas, so or even macules. It's important to note those down in those areas. So here's a pretty good picture to use when it comes to palpating for lymph nodes. So it kind of really clearly lays it out which lymph nodes are where. Often we do get to see the submandibular nodes in patients, and usually they are freely moving and non-tender, but it's important to know location. Submental, and then we also see the supraclavicular, the posterior chain. Sometimes it's called deep cervical as well, so those are some other technical terms for it. Occipital and the postauricular and preauriculars, but we just call it auricular lymph nodes. Okay, so here is another photo that kind of lays it out really nicely as well. So like I mentioned earlier, you can see the deep cervical nodes here, so I'll kind of point it out with my pen. So the deep cervical nodes right here, they tend to be around this near the SCM, so the sternocleidomastoid muscle. So that's pretty common to see there. Here have some accessory nodes back here. They tend to harder to feel for. At times I have in private practice the auricular nodes that are over here, so that's kind of easy to find. Another very common one is the submandibular nodes. So these are pretty common to find as well, so keep an eye out for those as well. So here is an example of what happens when your lymph nodes are inflamed or enlarged. They're tender. We do sometimes see this in patients who use marijuana, so that's a pretty good example why it's important to do your um, check. But something like this is more exaggerated, but a patient can definitely tell if they're feeling that on their neck. But on a smaller scale, you can feel for nodes like this, and then from there, if it's tender, we would definitely like to monitor and see how it goes for 2 weeks. Otherwise, we would want to refer those out. So, our three main glands intraorally are the parotid gland, submandibular, and a sublingual gland. We do want to palpate for them just to see if there is any tenderness around those areas. Often enough, though, we do check it intraorally just to see how the saliva is flowing, which we'll go in later. But it's important to know these three glands because it's important to know that if there is any tenderness in these areas, um, it can lead to further complications when it comes to salivary flow. Okay, so this is your thyroid gland. I find that in private practice, this area does go missed. So we often forget to ask the patient to swallow just to see if the way we close our larynx and the way it displaces, we often miss that. And it's important to see that it doesn't deviate in any way. So this is an important one to keep an eye out for as well. So often the times we need to write descriptors on how lymph nodes feel. So this is a pretty good table to note down on how to describe lymph nodes. So anything that's normal, it should be non-tender. At times, it is really movable. Excuse me. But we do want to say like that's a more of a atypical finding rather than significant finding. But usually, if we're not feeling anything or there's no tenderness, then that is a normal finding. Anything that you feel firm, tender, freely movable, it can be a sign of infection. So we want to make sure and kind of note that down and see if it gets any better. Because oftentimes our lymph nodes are there to um, filter through toxins in our body, trying to heal something. So if that tends to be freely movable, but then it goes away, or it just, if it was fixed and then it becomes non-fixed, so we want to monitor those things. If it ends up being the same and it's not changing in any way, it's best to refer the patient out to their physician or go see an oral pathologist just to make sure everything is looking okay and seeing what's the reason what's causing the lymph node to be inflamed or showing those signs. So I would keep an eye on this chart and have this in your reference in private practice and right now in school as well, just so it makes it easier to kind of find a descriptor and kind of point out which things are more important. Okay, so the previous last few slides, I know it was 52 slides, but what I wanted to do was that was a kind of reference point to kind of do a checklist, a visual checklist on what is the step process. And right now I'm going to go over a video with you on how the extra examination is done. Often enough, we find that um, because it's not in our daily practice, or even as seasoned hygienists, we tend to forget which areas are important. So that checklist is nice to have. Print it out, put in like more condensed notes, and leave it in your private practice or your reference binder if you have one for hygiene school. And I find this it's just more of a visual rather than kind of reading words on how to palpate things like that. So if you're not familiar with it. So yeah, that was for reference for you. So I wasn't going to go through each and every slide, but this video really sums it all up. So we're going to go for that video. So the video will be on, and I am wearing headphones right now. So what I'll do is I'll walk you through the video. So if you are playing this at the same time, just have it on mute. So I'm going to talk to you about it. And then from there, we'll just, I'll kind of pause and on and off and point out some key points and let me know if you have any questions. So you want to start off with the overall appearance, and that just includes your gait. So if some patient's walking towards you, that's the way you note down the gait. The posture, is it erect? Is it erect, curved? Because as older patients, you're most like if they're older, they tend to be more slooped over, so you want to note that down. Younger, obviously, they're more physically capable, so they're walking around, it's not as curved. Mental and physical limitations. I would generally say the physical limitations include just if they're having a hard time walking, the arm is not moving, things like that. That's important to kind of note down just because it does come in the way of if it does, or possibly might not even come in the way of your dental hygiene care. But those are some overall things that you notice, like the first few seconds are like, oh, this stands out, that stands out, that stands out. So those are the type of things that you want to mention in this area. Overall skin color, if they're pigmented, is there freckles everywhere? Just kind of just like a general idea. The eyes, are they sloopy, droopy, red? If the color's a little off, are they yellow? Why are they always yellow? So you want to note those things down. We don't have a separate section for that usually, but that's your overall idea. You can see around the neck as well, just to see if anything's off about it or not. So she's kind of starting off on the top here around the hairline. So the hairline's their starting point, so you're just kind of going around. And here you can just see if there's anything going on, macules, papules, pustules around this area here. Just kind of playing around with it, feeling if there's any tenderness around this area and kind of going from there. So right now here she's checking the temporalis muscle, and this often does get used if you are clenching. So if you can feel it right here as well. So if this is tense, if it's been frequent headaches, this will feel tender for some patients. So that's important to note down. The mastomer is obviously used when you're clenching, but this often you don't realize you use this as well. So what she's doing here is you want to see at the back of the neck to get your nodes at the back here, the occipital nodes, but often enough, you are getting a little more into the patient's personal space. So ask them to help you out. That way it's a little less awkward. You're not sure, so you look like what you're doing. At the end of the day, you are a healthcare professional, so don't shy away from doing this. Do your job properly. So don't do this like lame attempt of like, oh, let me just do this. Like especially like my hair right now, it's open. So have me lift my hair like this and get back in there. Don't get shy, because at the end of the day, you are a healthcare professional. You want to be able to note down any areas that you're not what often does go miss. Patients don't go see their doctor often enough. We ask them once a year, or if they're going regularly. A lot of the times they just go for if they have a cold-like symptom, flu, or if they need prescription refills. So they're not really getting this examination done on a regular basis. But often enough, patients are coming at least once a year or twice a year for their cleanings. So you as a dental hygienist have a responsibility towards this. So noting down all these areas. So she's feeling for those occipital nodes and kind of walking forward towards the ears. So you'll see that here. I'm jumping the gun here. Yeah, so she's starting with the posterior auricular nodes. You can feel that, just kind of using your fingers, kind of rubbing around. So you can see that she's doing both sides here. So just kind of working your way to the front, kind of going like that, and then kind of, because there's 3 points to it, so just kind of going like this. And then now you'll kind of reach to the point of the TMJ. So this is important because you already kind of have to follow this through a step process. So you're starting here, going all the way around, then coming back forward, and then you're like, oh, I'm checking the auricular nodes. Oh, might as well check the TMJ. The TMJ is right next to the ear. She is using 3-4 fingers here, and kind of going like this. That's a great way to use it. I find that they're using the middle finger, and not using pressure. Just don't use any pressure. I often find that we kind of put pressure on this. And just feel for it. Ask them to open and close slowly. In this video, she goes a little faster than I like, but I find that going slow, especially if someone says they have a history of clenching and grinding, they often, depending on the severity of the clenching and grinding, they might go harder with the clicking or the popping or deviation. Some don't. Maybe they have a history of it. You should ask that question, like, have you ever heard a clicking sound in the past? Do you hear a popping sound? Does your jaw lock when you open so wide? Those are signs of TMJ issues, and which might not be present in the chair when you're doing the examination, but might be done in the past. And just kind of noting down all those points there. So you can see that she's kind of putting the jaw forward, back, side to side. Now you can check in the masseter muscles, ask them to clench and clench, kind of see how prominent they are. So now she's checking the parotid gland. So see how everything is just in a proper sequence. So you're getting all those areas. You're doing your masseter muscles, and now you're doing the parotid gland. So just all kind of going in that flow there. So right now we're doing the submandibular glands here and the nodes. So you want to start from your coronal notch, kind of going forward. It's kind of like at the midline here of those, doing your chin here and this point. So you feel for those glands, ask if it's tender or not. So you can see this is how you check the nodes. So I think that we don't do a really good job in differentiating the two. So the glands are just kind of palpating up and down. So it's just kind of going up and down. But when it comes to the nodes, see how much exaggeration she should really pull down those cheeks and underneath there, just to feel for the nodes. But make sure you don't use a lot of pressure. Obviously, the nodes, if they were existing in the past, a lot of times they're freely movable and non-tender. But when they're freely movable, they do tend to move around. So you might catch it the first time and then not find it after that, or you've tried it a few times and then all of a sudden your instructor comes in or someone else does a check and they're like, yeah, I found the notes. They're like, oh, what? So you gotta be gentle. Just move the skin. Don't put your fingers in it and try pushing it out. Use less pressure. That's important. So you can see that she's trying to pull it and put it upwards there. So now you're just going to check the submental as you're at it. So now we're checking the medial nodes, or the deep cervical nodes. So this is your SCM, and kind of checking there. And there you go. You can see that. Everything is just in sequence. So now she's checking the supraclavicular nodes. So I would say she did this a little differently. She just kind of went over the supraclavicular. I find that when you roll it over your clavicle bone, I find that you find it a little better that way. But at the end of the day, don't use your fingers and put pressure. Lighten that pressure. Let it roll. Let it go through. Now she's doing the other side now. Just kind of rolling over this SCM, and then bilaterally, like digitally checking for lymph nodes for the deep cervical, and then now the clavicle. So now she's checking the sinuses. So these are your sinuses, and now she's checking the thyroid gland. So she's checking that thyroid gland and the trachea and larynx. There we go. So this is the, so you can, that was the extraoral examination. Keep this video for your reference. I find this video was explained beautifully, and this is a great guideline, and also the PowerPoint presentation is a great guideline to keep as well. So if you are unsure, if you want to practice at home, this is a great way to do this, so you can improve your skills. Any questions so far on this? This is mostly mainly on the extraoral. Now we're going to go into the intraoral and the beloscope. No questions? Okay, sounds good.